I understand the river system analogy of living murky in cesspool waters, but I think that if you're equating healthcare to anything, it needs to be the environment you live in. If you're living in a lush forest, you'll have ample food, clean waters, plenty of shelter from dangers. In a savanna, you have plenty of game to eat. However, water becomes harder to find. The supplies for shelter are almost non-existent. When you get to the desert, where everything you need to survive is a battle to find, and the barrier between life and death are paper thin. These difficulties are also found in the healthcare spaces, when there are inequalities both in advocacy and economic resources for different populations. However, instead of these difficulties being separated by hundreds or thousands of miles, they can sometimes be separated by a few feet. You can be sitting in a meadow sipping cool water from a spring where you have adequate medical coverage, access to specialty health care, early medical intervention, and access to information to make informed medical decisions, while your neighbor is spitting sand, unable to find shade or water, all because they didn't have medical insurance, so they couldn't get a cough checked out in time and are now buried in a mountain of debt. However, we can reverse this desertification of a person's life by providing mitigation to the disparity between their access and information and yours.
In a flourishing forest biome, energy is balanced to where all organisms get what they need to thrive. The climate is stable, while periodic rains replenish the community. If the rains were to cease, many organisms would be left struggling without critical resources. As it turns out, a community of people is not much different in that respect. In this scenario, the climate is an equitable economy, and the rain represents investment in the healthcare system of the community. Everybody in the community has the means to meet their needs, allowing them to contribute more to the community they live in. Financial resources are abundant, providing for the presence of dedicated healthcare advocates that link the people to the care, acting in the interest of both. The health needs of everyone are attended to, not only those who are more fortunate. Economic equity opens up more room for advocacy, while advocates help people save money on care costs, leading to more economic equity in the community. All in all, if the community is a flourishing forest, then economic equity is the rain, and advocates are the keystone species.
A struggling savanna is a more harsh environment with higher temperatures and a bit more scarcity of resources. In this environment, all the organisms have access to critical resources, but it depends on if they take advantage of it. In this scenario, everyone has access to healthcare, but seems to typically run into barriers. Access can be difficult due to lack of physical and financial resources, and the three most common barriers that are presented when relating to healthcare is approachability, availability, and affordability. Much like organisms trying to find food and water, the savanna provides some resources but may be out of reach for many. Organisms that get more access to resources would be the top predators, or in human reference would be the people with higher socio-economic status. Struggling continues for a smaller, weaker species in this biome. This community is run off people with higher education and better financial standings, while other people are being offered the same opportunities but find it hard to take advantage of. And since the majority of this community is often stopped by at least one barrier, the need for further advocacy is stressed. In this type of biome, families must often go great lengths to access healthcare, relying on occasional support, but never have enough stability to thrive.
Imagine standing in a vast, desolate desert. The sun beats down relentlessly, and the air is dry and unforgiving. This is the world of economic inequity in the absence of the advocacy, a place where survival is a constant battle. In this desert, water, the essential resource for life, is scarce, just as access to healthcare is limited for those without financial means. The wealthy have their oasis, pockets of shade and water where they thrive, while the vulnerable search aimlessly, struggling to find the resources they need. Healthcare, like water in the desert, is something only a few can reach. The rest are forced to make impossible choices, much like deciding whether to drink the last drop of water or save it for tomorrow. Without advocacy, there's no guide, no shelter from the harsh conditions. Families wander through this unforgiving landscape without a map, unable to navigate the complex system that could offer them relief. The absence of support makes the desert even more dangerous, deepening the divide between those who have and those who are left behind. In this world, inequality feeds on itself, creating a vicious cycle. The desert becomes harsher, and those struggling to survive find themselves even further from hope. To transform this desert into something livable, we must bring both resources and advocates to those lost in the dunes.
The success of an ecosystem doesn't rely on an individual organism. It requires input and support from everybody in the system in order to be healthy. Communities such as St.Joe will only thrive when access to resources is the same no matter who you are. Healthcare isn't the first step. It's a byproduct of equality and other factors such as education, access to well-paying positions, affordable housing that isn't industrial adjacent. Improvement in these areas alone would save the country over $1 trillion a year just by improving living conditions and access to options. When you have these policies in place, it alleviates some of the overload of the medical system. That makes implementing healthcare changes that help everybody look a lot easier to overcome.